From our Staying Healthy department, it's called frozen shoulder.
You've probably never heard of it, but it's a bizarre yet common medical condition that strikes mostly women. Stacia Matthews is here with the story. Stacia?
Well, Todd, many patients are giving their doctors the cold shoulder to ease their misery. It can last a year and take even more time to thaw. But all too often, frozen shoulder is misdiagnosed as bursitis, rotator cuff disease, or arthritis.
My right shoulder is almost completely recovered. I still have a little bit of range of motion issues, but the pain isn't there.
And that shoulder pain kept Natalie Heck in agony for a year. It started with an ache, then it got stiff, then it froze.
Had a lot of difficulty sleeping. I would wake up several times during the night because of the pain.
The symptoms are back in the opposite shoulder.
Hello.
Hi.
Hi, how are you?
Good, thank you.
I hear that we're having some trouble with your left shoulder.
Natalie suffers from frozen shoulder, the layman's term for adhesive capsulitis. It's a common condition that causes the lining in the shoulder to become inflamed, thicken, and ultimately prevent movement.
Typically occurs in women more often than men, about 3 to 1. It is typically in the age range of about 40 to 65. And maybe there is some hormonal connection. We're not 100% sure of that.
Dr. Peter Sallay usually thaws frozen shoulders with anti-inflammatory drugs, injections, and physical therapy. When those didn't work for Natalie's right shoulder, he operated.
We have a little device that we use that uses thermal energy actually to cut and cauterize that tissue to allow it to separate.
Natalie's mom had frozen shoulder. Her daughter worries it could be hereditary.
I'm scared of losing control over my shoulder.
But at 13, Amy doesn't have to worry about that now. As for Natalie, she hopes therapy will ease her new shoulder pain. If not, there's always another surgery.
I'll do it again, and it'll be with Dr. Sallay. It was a good experience.
Wow, you don't hear that quite often, that surgery is better than the pain. Well, doctors say they wish they knew what causes frozen shoulder, but they don't. Dr. Sallay won't be able to stop the course of Natalie's disease, but he can begin treatment early.